Today I am here to do the shoulder clinical examination. After taking the proper history of the patient, now I am going to do the examination to confirm my diagnosis. Now this is the patient. I have taken the consent from this patient to do this video examination and send it for the course. Now I am first of all I am going to do the inspection. In the inspection, first it is to be done from the front. Both the shoulders are at the same level. Both the shoulders are at the same level. There is no deformity present in the clavicle from the sternoclavicular joint to the AC joint. The supraclavicular fossa and the infraclavicular fossa both are normal, symmetrical. There is no wasting seen. Pectoral bulge is symmetrical on both the sides. Anterior axillary fold is symmetrical on both the sides, and there is no obvious wasting seen in the trapezius. And the contour of the shoulder from the anterior side is normal and symmetrical on both the sides. Deltoid bulge is symmetrical on both the sides. Now examination from the side, the deltoid bulge and the contour of the shoulder is normal and symmetrical on both the sides. Now the inspection from the back of the shoulders, both the shoulders and the scapula are at the same level. The inferior angle of the scapula are at the same level. There is midline symmetry of the spine. The supraspinatus fossa and the supraspinatus fossa and the infraspinatus fossa both are there is no wasting seen. The medial border of the scapula are equally prominent on both the sides, and there is no wasting seen, no deformity seen. The posterior deltoid muscle and the posterior contour of the shoulder is symmetrical on both the sides. Now we come to the palpation. First of all, palpation from the front. There is no tenderness present over the bony prominences of the clavicle, no tenderness present over the head of the humerus, over the greater tubercle, no tenderness present anteriorly over the shoulder, over the coracoid process and lateral to the coracoid process, and there is no tenderness present in the trapezius, no tenderness present in the supraclavicular fossa, and no hollowness or the fullness is seen in the supraclavicular fossa as well as the infraclavicular fossa. That shows there is no wasting, no tenderness present in the pectoralis, and no tenderness present over the deltoids. Palpation from the back, both there is no tenderness present in the cervical spine. Pain to नहीं, हाँ ना भी बोलना है. यहाँ पे कोई pain. There is no tenderness present in the supraspinatus fossa. यहाँ पे कोई pain नहीं. There is no tenderness present in the infraspinatus fossa. There is no tenderness present over the medial prominences of the scapula. There is both the inferior angle of the scapula both are at the same level. There is no tenderness present in the upper dorsal spine. There is no tenderness present over the posterior shoulder. Posterior tenderness is elicited by the just below and lateral to the posterior angle of the acromion. There is no tenderness present here. Now comes to the movements. There is a flexion up to 160 to 180 degree. There is an active extension up to 40 to 50 degrees. There is abduction up to the 180 degrees. There is adduction up to the 45 degrees. Now keep the arm like this. There is external rotation up to the 45 degrees. There is internal rotation up to the 60 to 90 degree. Now, not do like this. There is no pain in the circumflexion. All the movements are pain free, and there is no. Now this is on the passive. Passively, there is no restriction of the shoulder movements. Range of motion is full on both the sides. Right shoulder appears to be okay till now. Now we are coming to the strength testing of the rotator cuff muscles. First of all, there is an anti-cane test. Arm is abducted to 90 degree. Arm is flexed to 90 degree and abducted to 10 to 15 degrees. And now and pronated fully. Now I am asking him to elevate it. There is no pain in this. That means there is no tendon. There is supraspinatus is okay. Now I am asking the patient to externally rotate the arms forcefully. There is no pain present. That means the teres minor and the infraspinatus are normal. No, again. Now I am asking the patient to internally rotate. ऐसे forcefully करो करके रखो तो करके अंदर को करना है. Yes. On internal rotation resistance there is no pain. That means subscapularis is okay. Not do like this. Lift off test is okay. That means subscapularis is okay. Now I am going to demonstrate some provocative test. First test is for the impingement syndrome. Impingement syndrome first is the knee sign. He is elevating his arm and I am pushing this downward. There is no pain. And now I am pushing the shoulder to the subacromial structures. There is no pain. That means it is negative. Now this is the Hawkins test. Abducting the flexing the arm to 90 degrees. Then I am forcefully rotating it and pressing the head of humerus to the subacromial structures. There is no pain. This shows the test is negative. This is called Hawkins sign. Now this test for the impingement syndrome. Now the test for the acromial clavicular pathology. I am flexing the arm and then abducting the arm like this. Now I am forcefully hyper abducting the arm. If there is any pain, if there is any pain comes, that means there is a problem in the AC joint. There is no pain. Now the test for the rotator cuff ear arm drop test. I am asking the patient to abducting the arm to 160 degrees and then I am asking him to lower down the arm slowly. After, if there is a test is positive, after 90 degrees the patient is not able to hold the arm and it will drop it down. This test is negative in this case. Now I am going to do the test for the biceps tendinosis. That is the speed test. In the speed test, flexing the arm for 90 degrees, supination and 10 to 15 degree abduction. And now I am asking the patient to up his hand and I am pressing it downward. If there is a pain, that means there is a problem in the biceps. This is the speed test. Another. Now I will go for the shoulder instability test. In the shoulder instability test, arm is hanging by the side of the arm in a relaxed position, and then I will pull the wrist downwards to see if there is any depression just below the acromion. If there is any depression below the acromion, it shows the circus sign is positive, but in this case it is negative. That means there is no shoulder instability. Another test for the shoulder to detect the shoulder instability is the apprehension test. In the apprehension test, arm is abducted to 90 degrees. Elbow is flexed to 90 degrees, and then I will try to push the head of the humerus anteriorly and external rotate the arm. If there is any, if the patient makes any resistance in this, that means the test is positive, like this. This test is negative in this case. So these are the tests of the shoulder instability. Now I will come for the test for the labral tear. That is the very common pathology in the shoulder. In the labral tear test, the test is called as the O'Brien's test. In this test, arm is flexed to 90 degree, hyperpronated and 10 degrees adducted. Now I will ask the patient to elevate his arm and put the resistance against elevation. Yes. If there is any pain, that means the test is positive. If now I will again do the test in the supination. There is no pain in this test. In O'Brien's test, in hyperpronation, if the pain comes, that shows that there is pathology in the labrum or biceps or the AC joint. But after supination, if the pain goes, then it shows that there is a labral pathology and all other pathologies are ruled out. Now I will come to the come for the posture test. Now do like this. Do like this. Yes. Yes. Now again do on that leg. Yes. Both the shoulders are at the same level on both. That means the posture of the patient is okay. Now I will test for the nerve test for the axillary nerve. There is a equal sensation on both the sides on the upper aspect of the deltoid region. That means there is no abdominal palsy. There is no sensory loss over the lateral part of the forearm. That means the musculocutaneous nerve is okay. Now I will test the grip strength. Grip strength is symmetrical on both the sides and elbow flexion, elbow flexion, wrist flexion, extension are equal on both the sides. ऐसे मोड़ने की कोशिश करो. Elbow flexion is 5/5. सीधा करो. Elbow extension is 5/5. सीधा करो. Now इसको ऐसे ऊपर लिखो. Shoulder flexion is 5/5. इसको थोड़ा ऊपर. ऐसे ऊपर. Shoulder abduction is 5/5. इसको भी उठाओ ऊपर. Shoulder abduction is 5 on the left side also. So there is no nerve deficit over both the sides. Now I think this is, and both the arms are the girth of both the arms is symmetrical equal.